of the key issues that I think have come up is the ownership of the data that it's trained on. Are people given their consent to have their data used to potentially train the models? And also times where it will be used, do you have to be told about that? And I suppose there's an issue around the security of the data. It is really, really sensitive. And there's a fear that it could leak. I suppose it will be a really rich source of material for someone to hack into. The data is potentially valuable as well to other companies, like the pharma sector was mentioned. And it's suppose putting something that gives confidence to people that their data won't be used for any other purposes.
For me personally, I believe that AI should be used in the scanning of diagnoses to help pick up on things like early cerebral palsy. I don't believe AI should be used to empathize or kind of communicate with people through chatbots. I do not believe AI can effectively communicate with people through that. From someone with experience in mental health and working with young people in mental health, I don't believe AI can replace people in terms of empathizing and being able to help someone.
My main concern at the start of this process is the same concern that I would have now, and that's about the human input. So I feel that there's a distinct difference between the digitalization of health records and the use of AI to support admin, and the use of what in time will be generative AI, and the risk of AI being used to diagnose, maybe to replace the human element. I feel that there should always be a human input into the process of decision making in healthcare. My fear would be that AI will be such an easy access point to data that will it reduce the amount of personal research that healthcare workers will carry out, and then reduce their ability to make decisions for themselves without the support of AI.
And one of the factors of things which I believe we should follow, I have it here, which is one, that we should improve the diagnosis and the use of AI, which what I mean is that this will analyze the medical image, lab results and patient data to help doctor diagnose diseases more accurately and quickly.
I think having gone through the jury process, we realise how, from listening to the expert witnesses, how AI can help us to free up administration, which will benefit our waiting lists, and it will actually benefit all of us. Once the government and policymakers are extremely transparent and continuously telling the public how they're using AI, how it's benefiting us, and possibly even showing us where AI is actually working and helping our healthcare system.
I think that despite the complexity of the subject and the hype around the AI, despite the clear divide in opinion throughout the jurors, we've been able to emit clear recommendations regarding the rollout of AI within the Irish healthcare system.